Hello everyone. So till now we have seen the definition, etiology of thrombosis, then the types of thrombosis, its morphological appearance. So if you haven't seen that video, here's the link in I button. Go and watch it first, then this video. In this video, I will be talking about the fate of thrombosis, that is the future of thrombosis in our body, and then clinical effects of thrombosis. Myself Shweta Anande, and I'm studying in second year B.H.M.S. If you haven't subscribed to my channel, please do so for awesome and useful content. Hit that like button and also press that bell icon to get first notification of my videos for you. So let's get started. The fate of thrombosis. That means what will be the future of thrombus formed, whether it may be from artery, veins, capillary or cardiac. Okay. So the fate of thrombosis is resolution, organization, propagation and thromboembolism. We will see the one by one. First one is resolution, which is means the thrombus get reabsorbed and mix with the bloodstream, which is very easy, important and a life-saving event, the resolution of thrombus. Okay. Then second is organization. If the thrombus is not removed, then it starts getting organized. That is nothing but the vascular proliferation with the help of neutrophils and macrophages. It is organization. Then third one is propagation. The thrombus may enlarge in size due to more and more deposition from the constituents of flowing blood. That is, as I have told earlier, that white thrombus is overlapped by red thrombus, then again platelet adhere and result in formation of white thrombus. Again over it the RBCs, WBCs get adhere and forms the red thrombus, and it goes on. Okay, and ultimately it can block the lumen. So this is nothing but the propagation. The fourth fate of thrombosis is thromboembolism. We have seen this term before as well in the bad effects of thrombi formation, that is, first was infarction and second was this thromboembolism. So what is thromboembolism? It is nothing but the part of thrombi which is detached and released in bloodstream from its original site as an embolus, and which will produce ill effects at the site of their lodgements. So this was all about the fate of thrombosis. First was resolution, then organization, propagation, and last was thromboembolism. Now the last part is clinical effects of thrombosis. We are on our last part of thrombosis. Please share your opinions on this series, thrombosis series, that it was helpful for you or not. So the clinical effect of thrombosis depend upon the site of thrombi, that is where it is formed. We have seen the various types of thrombi like cardiac, arterial, venous and capillary. Then its rapidity of formation, like the structure, first platelet which is nothing but the white thrombus and then red thrombus and so on. Okay, so this is the rapidity of formation, and then the nature of thrombus, like soft, red or hard. Okay, so the clinical effects based on these 3 points, that is site of formation, the rapidity of formation and nature of thrombus. Now we will see the clinical effects occur due to formation of cardiac thrombi. If there is formation of large thrombi in the heart, may cause sudden death by mechanical obstruction of blood flow or through the thromboembolism to vital organs. That is, it is very much fatal to life by causing the sudden death or thromboembolism. Then second is arterial thrombi. This causes ischemic necrosis of the deprived part, that is infarct, which may lead to gangrene. Sudden death may occur following the thrombosis of coronary artery. First of all, what is ischemic necrosis? Ischemia means the lack of oxygen which causes necrosis, that is the death or damage to the cell or tissue. And this death which is occurred in that particular tissue or cell will lead to gangrene. Now what is gangrene? It is a massive death of cell or tissue with putrefaction, that is degeneration of that tissue. Okay, so arterial thrombi will cause ischemic necrosis. It is also very fatal to life. Then third one is venous thrombi, which is also called as phlebothrombosis, and this may cause various effects such as thromboembolism. Now only we have seen this. Then edema of area, poor wound healing, as any injury will not be healed fully because of lack of blood supply, as the thrombus will resist the blood flow, and which will cause lack of oxygen or blood supply and will result in poor wound healing. Then fourth one is skin ulcer. So these are the complications of venous thrombi. Last clinical effect is of capillary thrombi. As the size of capillary is too small, so the formed thrombi will also be micro, that is microthrombi, and which will cause the disseminated intravascular coagulation, that is DIC, in which the abnormal clumps of thickened blood, that is clots, are formed inside the blood vessel. These abnormal clots use up the blood's clotting factors, which is unnecessarily, and which will cause or which will lead to massive bleeding in other places. In short, it is a condition affecting the blood's ability to clot and stop the bleeding. So here we are end up with the thrombosis, the most important topic of general pathology, in which we have seen the introduction, definition, etiology, that is virtue of stride, then types of thrombosis, morphology of thrombus, fate of thrombus, and clinical effect of thrombi. So in next video we will again meet with new topic. Till then, stay safe, stay healthy, keep learning, always dare to be wise. Like, share and subscribe.